prayer. Thank Ms. Dunstan for talking to us about the program at the church. I want to say, first of all, I'm very grateful to the church for hosting us here, and I'm very humbled by being at this very historic spot. Frederick Douglass spoke at this corner at this church. Elizabeth Cady Stanton spoke at this corner at this church. A whole list of civil rights activists for every form of social justice we care about, has spoken at this church, and I'm very, very honored to be here today. And I want to thank them all for hosting us. And it's appropriate that we're here today, because health care is the civil rights issue of our day. As Dr. Martin Luther King once said, the form of injustice that is most offensive to us right now is the fact that people cannot afford decent health care in this country. And we are going to change that this year. In November 2008, 8,000 people were losing their health insurance every day. Right now it's 14,000. Was it acceptable in November 2008? No. Is it acceptable now? No. Are we going to do something about it? In November 2008, 122 people were dying every single day because they do not have health insurance. Was it acceptable then? No. It hasn't changed. Is it acceptable now? No. Are we going to do something about it? Yes. In November 2008, 500,000 people a year went bankrupt, and most of them went bankrupt because of health care costs. Was it acceptable then? No. It hasn't changed a bit. In fact, it's gotten worse. Is it acceptable now? No. Are we going to do something about it? Yes. In November 2008, health insurance costs have been going up at a rate of about 8% a year. Was it acceptable then? No. Since then, they've gone up at 10% a year. Is that acceptable? No. Are we going to do something about it? Yes. Right, we are going to do something about it. We are going to make so much noise, as we have for the last 19 months on this trip. Have so many people come out and support us. The Congress and the President are going to listen to us. We are going to get health care reform this year. Now we have a long way to go, and I want to get started with the rest of the program because we're going to walk there. Although considering that I've been sitting in my car for the last 20 minutes, 4 blocks away from this church, it might be that we'll get there faster by walking than we would if we could drive. So I want to first introduce Dr. Cheryl Benegal, who is a member of the National Physicians Alliance, has been a supporter of ours. The organization's been a supporter. Dr. Benegal has been a supporter. She's spoken for us many times before and organized events herself. She's going to talk a little bit about the doctor's perspective on healthcare reform.
Thank you, Mark. So I'm Dr. Cheryl Benegal, and I'm a family doctor here in Philadelphia. And I want to thank you all for coming out today, especially those of you who are going to be marching all the way to Washington or even part of the way. And particular thanks to Mark, who has worked his tail off to try to make this happen for all of us. I've taken care of uninsured and underinsured folks in Philadelphia for the past 10 years. And that work has surely shown me that our current healthcare system is medically unacceptable and morally unacceptable. Your commitment and dedication to changing this system is inspiring to me as a doctor and as an American. We're here today for Melanie and for all the patients who struggle as she did for the right to make their medical decisions with their doctors and not with insurance administrators. Yeah. We're here for patients like the hardworking young woman I saw last week who suffers from a debilitating neurological condition she was born with, first. And second, from the fear of complications because she can't afford to get the monitoring she should be getting. Her employer doesn't offer her insurance, and you can imagine what happens when she tries to apply for insurance with that pre-existing condition. We're here for the thousands of retirees in the same boat as my patient with heart disease who retired before she was eligible for Medicare because she was having health problems, only to find out that she couldn't afford her medications. She had paid insurance premiums for 30 years and found that she had no insurance when she needed it most. And we're here for the ever-increasing numbers, and I see them coming into my clinic every day, of Americans who drop their coverage because the premiums go up and up and up, and unemployment goes up too.